This is our last question, and this goes to our medical oncologist, and we're turning back to the EGFR space. So for a patient that has EGFR-positive disease, we'll say this is a classical EGFR mutation, exon 19 deletion L858R, and they started on a targeted therapy like osimertinib up front. And unfortunately, the cancer starts to grow. You get biopsies, you get blood tests, and it starts to show complex patterns of resistance. An example is a C797S mutation, other complicated changes. If you have to choose another systemic therapy, what's the best option at that time? Are you reaching for amivantamab? Are you reaching for chemo? Are you pushing the patient for a clinical trial? How do you choose?
So it depends on the amount of progression, right? We can always, if it says, a localized progression, you can consider localized therapy. But for C797S and other complex mutations, probably I'll consider amivantamab, although there is plus minus chemo, or probably plus chemo per Mariposa 2. There is some evidence on combining osimertinib plus erlotinib in patients with a classical EGFR developing C797S because that mutation can cause resistance to osimertinib, but it can sensitize the tumor cells, or at least the cancer cells, to earlier generation TKI. I've used OC plus erlotinib, and it worked for actually a good period of time in one of my patients. It's this combination is a little difficult to tolerate, but with some dose reduction, you can get the patients through.
Yeah, thank you. Dr. Patel?
Yeah, I think he brought up probably the two big options that we would look at. Obviously, if it's progression, you're looking at the local therapies. I do think, amivantamab has not been the easiest drug for a lot of patients to tolerate. There's a lot of infusional reactions, and with our new data about giving steroids, people have been able to tolerate it a lot better. But we do combine it with chemotherapy, right? And so picking the right patient for that, with the increased side effects of erlotinib plus osimertinib versus adding chemotherapy, I think that's going to be a lot of a discussion with the patient depending on the situation specifically, but also, what is their ability to tolerate these symptoms?
Yeah, perfect.
And then
All
most
right.
importantly,
Uh,
sorry, clinical trials. There are some new
yes.
allosteric EGFR inhibitors that are coming soon, either in trials or in the market, that work, supposed to work against C797S. So they'll always look for clinical trials.